Hello, I am Lucy Ainsworth and I work in nursing and midwifery at the National Institute for Health and Care Research. Today I am joined by two amazing nurses from Manchester University NHS Foundation Trust, Gabriella Lindergard and Claire Fox. This short interview will form part of the celebrations organised by NIHR Nursing and Midwifery to acknowledge and celebrate the achievements of nurses and midwives everywhere as part of a mini campaign to celebrate International Day of the Midwives and International Nurses Day. Gabriella and Claire, thank you for joining me today to tell us all a bit about the work that you have been doing at Manchester University NHS Foundation Trust within your specialist area of infectious diseases. Please could you begin by telling us a bit about yourselves and what inspired you to become research nurses?
I think there are many ways you can get into research, and I think probably every research nurse has a different story and their own reasons to get into applying for this kind of job. I was an infectious disease nurse before being sidetracked into academic science, and it was many years before I realized I could actually combine research and nursing by becoming a research nurse. I think I didn't really know what the job entailed, like what you would do day to day.
For myself, I think it was that research found me more than me finding research. I think I sort of, one of my old colleagues was saying how exciting research were, and to be honest with you, it was something that I hadn't really thought about. And then a job came up and I was like finding a bit more out about it, and I've sort of been working in research ever since.
For those that don't know much about your specialist area, please could you tell us a bit about the unit you work in and the importance of this specialty?
So we work in the Infectious Diseases Research Department at North Manchester General. So it tends to cover all the regions of the Northwest. We're working very closely with RID colleagues, like all the doctors and specialists from that area. And we cover a very wide range of studies. The bulk of them would be like the HIV and hepatitis, but we do cover other ones such as meningitis, TB, wound infections, that kind of thing as well.
Yeah, we're a small team, but we have managed to complete quite a lot, and it's been really rewarding and interesting. When we both started about 8 years ago, the department was already involved in several hepatitis C studies, and there were new drugs available, and the sponsor was hoping these were actually going to treat the infection. And it was absolutely amazing to be part of this process, to see how it went from there being no real hope for a patient at all to a complete cure after only 8 to 12 weeks of treatment. The most exciting now is probably the development of the long-acting HIV medication, and they've actually just been approved by NICE and started being used in NHS.
Can you tell us a bit about one of the international studies you have been involved in recently?
So when the pandemic started, we quickly became the COVID research team, and we opened 10 COVID studies within 6 very intense weeks. And one of our first treatment studies was the Covacta study using the tocilizumab drug. And normally these kind of studies, they would take years, but now everything has to happen very quickly. The protocol kept changing, the lab requirements kept changing, and it kind of kept us on our toes.
Yeah, I think the COVID, for me, the Covacta study in the COVID time, that was probably the most exciting. We found that there was a potential drug called tocilizumab, which seemed to turn around patients within like a 12 to 24-hour period. So we found this really exciting because at the time there weren't an awful lot that we could be offering to patients because we didn't know enough about it. So I found that was a really good thing for us, and then obviously that came out.
Wow. COVID-19 has raised the profile of research, especially in infectious diseases. How has the pandemic affected collaboration and study delivery?
like you said, before the pandemic, we used to do a lot of outpatient clinics. So I think that when COVID hit, we very quickly had to collaborate with lots of different areas. And we found that we had people that was dropping their speciality moving over to COVID because everybody just focused on COVID solely. So we had people from different sites and different specialities, and we all worked really well together, I think, didn't we? We all sort of came together and we knew we had one goal, which we're trying to help the patients more than anything. And I think that gave us, we were going out a lot onto the wards, and then we were raising awareness for research. People wanted to know what we were doing. So it was really good from that point of view.
Yeah, some of the nurses were really amazing. They started talking to the patients even before we got there, so they already knew a little bit about trials. And because there was nothing else, no specific treatment apart from oxygen to offer the patients, so taking part in the trial was really the only way to have some access to something that might offer you a better chance. And doctors and nurses, they started phoning us and let us know when they had patients that were interested in trials, and so that was something that hadn't happened before.
How have your own backgrounds in infectious diseases helped prepare you and your colleagues to deliver research throughout the pandemic?
I'm not sure anything managed to prepare us. Maybe we were a little bit less hesitant to go and see the COVID patients because we were used to working with people who had contagious illnesses.
So I don't think anything could have prepared us for the scale of what we were presented with. But I do feel that I think at the time there were a lot of people that were critically ill and becoming end of life very quickly. I think that because there were no treatments to offer at the time, we felt that urgency that we needed to try and find something to try and offer something for our patients, to try and do anything really to give them an extra chance.
How can nurses and midwives get involved in research?
I think the pandemic helped to show that nurses at the ward can actually get involved in research, even if you're not ready to become a research nurse. The first step is really to talk to your patients about research and to us when we're out there, and let them know that taking part in trials is really part of standard of care, and like everybody should have the chance to be offered to take part in research when they come into hospital. And I think if someone has spoken to them about that all the time, then it doesn't really just come out of the blue when we turn up and they think, why have I been singled out? And the nurses at ward, you will become an advocate for research.
Do you have a final message for research nurses and midwives here in the UK and globally as they celebrate International Day of the Midwives and International Nurses Day 2022?
I think we should stop and think sometimes that we are part of a bigger picture and think about the results of the trials and how important it is to know what actually works and what doesn't work. And really, it's only then that we can start giving the best care to our patients.
I think like you said, you don't stop and reflect. You seem to go, and then you're on to the next thing. So I think it's like well done to everybody, because obviously the research journey, there's a lot of things that are involved in the research to then get it out to the forefront of the NHS. And like I said, you do not always get that opportunity to just stop and reflect on what you're achieving.
Thank you so much for your time today, Gabriella and Claire. It's been an absolute pleasure to capture this discussion and to hear from you both. Take care. Goodbye.